So I've got another scenario for you. So you have a horse that's got arthritic changes, they have got poor energy and weak hindquarters, and sometimes they can be a little too fearful about new objects. Hi, I'm Dr. Rebecca, and all this week we're talking about the organs in Chinese medicine. So the organs in Chinese medicine have a much broader aspect of like what they do in the body than when we think about Western medicine. And one of the most important organs whenever we think about heredity or we think about DNA or we think about all those Western medical terms, we're going to be looking in the Chinese medicine system of what we call Jing and ancestral qi, and we're going to be looking at the organ system of the kidney. So in Chinese medicine, the kidneys are not just an organ, they're an organ system, and they have to do with the constitutional level or the constitutional strength of your horse. A lot of horses that suffer from chronic disease are actually injuring the kidney system or have a weak kidney system. And this system really has to do with the horse's ability to stay strong and healthy over the long haul. So let's go over the top 5 sort of indications or the top 5 functions of the kidney system in Chinese medicine. So the kidneys store Jing or essence, or what we would consider like this inherited constitution of the horse. So it's most related to what we think of as like DNA or what your horse inherits from its dam and sire. And it really looks at the potential for the development, good development, growth, longevity, fertility, and those deep reserves that the horse will require if it ever has a long-standing illness or has anything that taxes its system over a long haul. Strong kidneys are going to support bone, strength of the bone. It's also which relates to like good teeth, but even not developing arthritis, not developing things like OCD or any sort of developmental disease, and just the resilience over time. This is also related to Jing. And so when you have like early aging or developmental disease, chronic weakness, or just a failure to thrive, it's always going to stress the kidney system. So that was number 1. Number 2 is that the kidneys really have a lot to do with growth and development and reproduction. So we kind of talked about that in the first one when we talked about the Jing, but the horse's kidneys oversee bone, they oversee maturity, they oversee proper formation. And so if you have a horse that's having fertility issues, we're going to be looking at the kidney system. If you have a horse that has arthritic or bone issues, we're going to be looking at the kidney system. If you have horses that are just weak in the hind end and weak in what we would call the lower jowl, we're going to be looking at the kidney system. Even if you have a horse that's like getting old early, right? There's some horses that seem to look like they're going to live forever. And then there's other horses that get into their late teens and they already look like they're 28. Those we're going to be looking at the kidney system. So the third thing, and we've already talked about this a little bit, but the kidneys really govern bone. So especially structural integrity, joint strength, and even the spine. So a lot of times if we work with spinal issues with the horse, we're working with the governing vessel, we're working with the conception vessel, and we're also working with the kidney system. Of course, the kidneys also influence the brain. So whenever we have an issue related to the brain, we're going to be working with the kidney system. And that includes things like coordination, neurologic strength. And even though there's more complications in neurologic problems, we are going to be looking at the kidney system. And even things like clarity and their ability to learn are going to be related to the brain. And so while they're also related to the spleen, they're also related to the kidney system. Weak kidneys can actually present as hind limb weakness, stifle problems, chronic joint degeneration, and even neurologic vulnerability. Of course, some of them are multi-systems involved in that, but we are going to look at the kidneys. The fourth thing is that the kidneys really regulate fluid. So this is a little bit how we think of the kidneys in Western medicine, but they help separate the pure from the impure fluids. So how we would think of the kidneys in the Western medicine, that they're actually filtrating out and the things that need to be excreted go out through the urine. And so it supports proper urination along with the small intestine, but we'll get into that organ in a different time. So dysfunction here though can show up as edema, usually in the lower limbs or the lower part of the body. difficulty regulating hydration. Okay, so a little bit if you think of anhydrosis, but there's other systems involved in anhydrosis and a lot of heat involved in anhydrosis. But you can also see problems with urination, excessive urination, fluid accumulation patterns. We're also going to look at the kidneys when we look at metabolic disease. So there is a difference between the spleen's role in fluid metabolism and in the kidney's role of water metabolisms. And we're just going to look at more of the kidney as the root, just like we look at the kidney of the root of a lot of things because of its deep connection to the horse's constitution. So I alluded to this in the beginning. So number 5 is actually about the behavioral aspects of the kidney system. So every organ system in Chinese medicine also relates to a behavior or 5 element and also to a behavior. And so in the kidneys, that is both willpower and fear. So if you have a balanced kidney, you're going to have a horse that is secure in themselves and has the ability to go out into the world and accomplish what they need to accomplish. If you have a horse that actually has an excess kidney energy, they'll be very, very, very willful. If you have a horse that is deficient in kidney energy, they will be very fearful. So sometimes you'll have those horses where they have arthritis and they're just kind of weak constitution, and they also are very fearful. That's classic kidney. Now, we don't always see just classic. Well, a lot of times we see the inner layer of multiple systems, but that's classic kidney. So the kidney energy will actually support courage, steadiness, and the ability to handle pressure. And an imbalance can show up as fearfulness, insecurity, hypersensitivity to stress, or conversely, reckless overexertion, right? So you think about the human who is like the thrill seeker who just like will do anything regardless of whether it might kill them, right? So you can also have that sort of energy in the horse where they're just have this reckless abandonment and they kind of get themselves in trouble all the time. So that's the kidney. I know it's a little complicated, and I know that sometimes you guys are listening and I've already had a question about like, well, what do we do about this? And we'll get into that in the future. Part of that will be come join me in the Hale and Hardy Horse Collective, because we're going to go deeper into this and actually not just give you some information, but show you what to do with it. But just stay tuned because we'll be doing more of these.